In the 1980s, many cities around the country were confronted with a new drug problem, crack cocaine. The result was a dramatic surge in violence and health problems, but years later, many believe that damage was compounded by an escalation in the war on drugs. Our guests have been researching the topic in their study of journalism and criminal justice at Northeastern University. We'd like to welcome Joseph Tache and Prasanna Rajasekaran. Thank you both very much for being with us.
Thanks for having us.
Joe, people my age remember what this was like, but for people who don't remember and don't know why it was such a big deal, what was going on with crack cocaine?
Yeah, I mean, I think this is something that we covered. We looked at the 1980s, and then we saw, to really understand the 1980s, you had to look at the decades that preceded it. So there's a lot of political and social and economic challenges leading up to the 80s, throughout the 60s, 70s. The first thing that we talk about is kind of the war on crime in the Lyndon Johnson era, and this creation of a black pathology, and in some ways, black people's culture, especially in low-income urban neighborhoods, was portrayed as being flawed, inherently flawed, and that was a fault of failure of parenthood and specifically of motherhood. So basically, that is used to demonize black people and the use of drugs, and the typical drug user was viewed as a black person. So as much as the impact of crack was something that was definitely monumental, there's also this social component that demonized drug use and drug selling that compounded a lot of the issues. And then of course you had some of the market violence around crack that we talk about in the podcast as well.
Talk about the distinctions that I encountered, at least when I was in parts of Boston in those days, especially in the black community. I didn't meet many crack dealers or crack users, but I met a lot of people who said, what's happening with the violence here? People are acting crazy. They thought it was really terrible.
Yeah, I think that's a really important point, that the use of drugs in society in general is overblown. There's in all communities, there's a much smaller proportion of people who use drugs, especially who are addicted to drugs, and we're told in media and through political speeches. But in terms of the violence, it's essentially something that we look at is, as the 20th century progressed, our economy in the U.S. fundamentally changed from being a manufacturing economy to being more of a service-based economy. And with that change, we saw a lot more discrimination in hiring practices, because there's more interaction between employees and the customers, and also employees and their bosses. So those cultural differences that are intensified by racial segregation, they became more of a problem. So while manufacturing employment was actually equal across racial lines, it wasn't equal across service sector lines, and that kind of lack of opportunity in many low-income black neighborhoods created a need for employment, and for some people that became a viable option, specifically in the crack market.
Prasanna, what about the part of the project that you worked on, talking to people who live in the neighborhoods, at least that were going through this back in the 80s?
Yeah, no, that was definitely the most important part of the project for us. So obviously we're college students, and coming into Northeastern, we were both very excited to be part of this urban college experience. But what you don't realize is that a lot of urban colleges are sort of walled off to the community around them. So Northeastern encroaches into Roxbury a little bit, but as a student, you're pretty much told, don't go into Roxbury. Roxbury has this vibe, or there's this idea surrounding the neighborhood that it's very criminal, very violent, etc. Don't go there if you're a college student. So yes, you're in this urban setting, and you're technically in the community, but you never interact with the community, or you're disencouraged from interacting with the community. So, as we went along in our college careers, we started to realize that. And so a big part of this project was, all right, let's break that mold a little bit. Let's go out into the community and let's listen to them. Let's hear their stories. And so, when it comes to crack cocaine, that's a huge part of that narrative and that, history as well. These people were, especially black communities, were misrepresented throughout the 1980s in regards to crack. And so, being able to go out there and hear their, honest retelling of what actually happened is really the basis of our entire project.
Joe, one of the things I remember from the 80s, and it wasn't always explicitly connected with crack, I remember the presidential campaign in 1988, the Willie Horton ads, then we had a governor elected in 1990, Bill Weld, talking about having the prisoners go back to the joy of busting rocks, the mandatory sentencing. Talk about that, what that meant, the result of that.
Yeah, I mean, today there's a lot of discussion about the disparities in our criminal justice system, and you can trace at least a large portion of that back to the war on drugs and a race-specific focus, particularly in disparities of how crack offenses are sentences versus powder cocaine, and how arrests are made in communities of color, and the same arrests aren't made even though drug use is still prevalent among all demographics, but you won't see DEA agents charging college dorms trying to make drug arrests. So, there's definitely a lot of factors that go into the size and the disparities in our justice system today. But when you look at, the Anti-Drug Abuse Act of '86 and '88 and the '94 crime bill that Bill Clinton signed, they're putting, 100,000 new police officers on the streets. There's very clear connections between the war on drugs and the racial disparities in our justice system today.
We're talking with Joe Tache and Prasanna Rajasekaran about the crack epidemic era and the criminal justice phenomenon. Prasanna, what about researching this? Because you have to sort out about both the nature of the drug problem and the overkill in response. How did you do that?
Yeah, so basically, like I mentioned earlier, part of our research was just going into communities that were severely affected by the crack scare and understanding those personal experiences. And then another part of our research was looking into academic sources. That's research from sociologists, economists, about the crack scare and, how it was, the difference between how it was portrayed and what actually happened. That's one of the main themes of our project. So the portrayal of crack as this horrible drug that was taking over urban communities throughout America was largely a political maneuver. That's one of the main things that we found out. And because of that, data and research was often skewed to support that narrative. So we wanted to go back and find sources of data that were not skewed by this narrative and just find real raw data, basically. And when you look at the raw data, it paints, and ignore the political narrative, it paints a totally different picture about what was happening with crack in these communities in the late 80s.
Well, what about the trend in how much this was used? Because one version I heard said that basically that it was almost as if the problem were created by the hysteria as opposed to pre-existing that. That's pretty accurate. It was basically created by the hysteria. That isn't to say there wasn't a slight uptick in use in the 1980s. There was. Crack definitely became more of a thing per se in the late 80s, but the extent to which crack was infiltrating these communities was extremely overblown. I think there's statistics that I think from the late 80s to the early 90s, there was a survey done of crack usage in high schools, in urban high schools, and basically what the data showed was, yes, there was an increase in usage, but it was from 0.1 to 0.4% or something extremely nominal like that, extremely minimal. So yes, crack became more prevalent, certainly, but that prevalence is largely overblown. Joe, what about the ability of all this to define the communities? Because I'm thinking, on one hand, you have people outside the community trying to define it very negatively, and then you have hip-hop.
Yeah, I think what we really tried to do with the project was highlight voices that aren't usually highlighted in traditional portrayals of the crack scare and of drug use in general. So people who lived in those communities and still live in those communities, they deserve to tell the narrative how they see it. And we don't want to diminish the impact that crack had in people's lives. You can talk to people who live in Dudley and say that they had a family member who was addicted and that really impacted their family. And it's not something that they remember fondly, but also it's very important to understand the structural impacts that led to it led to why we view crack in the way that we do. And Prasanna was referencing some studies earlier that people who use crack, if you look at people who are addicted, oftentimes they were drug users prior to crack even being introduced to them. And they're vulnerable in other ways, in other socioeconomic ways. So we try to look at the project in a more holistic societal way and not overblow drug use in itself, but look at other systemic inequities.
Prasanna, what about the effect in terms of violent crime? Because I think in Boston during the 80s, things got pretty bad. Then almost abruptly, somewhere in the 90s, it got a lot better. And I'm saying that couldn't just be about drugs.
Right. No, and that's exactly right. There was this sort of backdrop of this crime increase that was happening as the crack scare was coming into play. So a lot of politicians, a lot of people in the media connected violence to crack. And that connection does exist to an extent, but once again, like the crack scare in general, it was blown out of proportion. So yes, because the crack economy, because all drug economies are essentially black markets, they are enforced with violence. And so when drugs become slightly more prominent, violence does increase as those markets expand. But as we saw, what we've seen in the history of crime in America is that drug usage rates and crime rates are not very correlated, and the reasons for crimes rise and fall throughout the decades is often something that's very, very hard to pin down. So there are a lot of factors that go into crime rates, and drugs tends to be one factor, but a relatively small factor at that.
Joe, compare this era to the opioid era that we're going through now. Especially, you think that with opioids, maybe more people are dying, and yet there's less violence going on too.
Yeah, the opioid era has a lot of very unique aspects that most drugs don't, and I think the biggest thing is that most opioids that people are overdosing on are prescription opioids, in that you can acquire them in legal ways. And when you can go to a pharmacy and get a drug, it's a very different there are different implications than if you have to get drugs in illegal ways, and you can have more formal ways of mediating disputes and saying, I pay you $20 for Oxycontin because this is what it says on the label. There's not a lot of room for dispute. So I think because of the way the opioid scare is set up in general, it's a different type of drug scare than any of the drug scares we've seen in the past because of that, and also because of the racial composition behind the opioid scare. For example, there are studies that show that doctors are less likely to prescribe prescription drugs to black and brown people than they are to white people, and that could be one of the reasons why the opioid scare is skewed racially in the way that it is, and the reason why we're now seeing the typical drug user in this case being a middle-aged or younger white person, as opposed to what people would typically see as a drug user. And even though people have always used drugs of all demographics, it's the perception of who the drug user is often colors what our response to that drug scare is.
Prasanna, talk about the experience of doing this project the way you had to do it, because this wasn't just about going on the internet or some library and going through files. I mean, this is, you had to get out in the neighborhood, in the streets.
Yeah, no, definitely. And yeah, we talked about this a little bit earlier, but that was a huge motivation for even doing the project in the first place. But yeah, it was definitely, as college students who are not originally from Boston, to come into the city and email community activists, community workers, people who were affected in Boston by what happened here, 20, 30 years ago, we're outsiders, right? So we definitely had this sort of apprehension coming in, being like, will people respond to us? Will people want to talk to us? Will people open up to us in Boston, being not from Boston? And what we found was that people were incredibly open with us, incredibly welcoming. And, I think a lot of times people, send out mass emails to try to get connections for a job or whatever, and like they'll talk about how they got a hit rate of like 10%. Our hit rate was like 75%. Like a vast majority of the community members that we reached out to ended up doing an interview with us, and I think that just speaks to the testament of how open, Boston's Black communities were in sharing with us their experiences.
We should mention you've got this all, at least a good part of it, on a podcast. So if people want to track that down, what's the best way to go?
Yeah, so we have a 7-episode podcast that details our research and includes all of the interviews that we have. You can find that podcast on SoundCloud.com. It's www.soundcloud.com/colored-podcast, and you can also find it on iTunes.
Well, thank you both very much. Prasanna Rajasekaran and Joseph Tache from Northeastern University. We'll have more news in just a moment.